Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, 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 you guys. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review books, review videos, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, I always like to get into my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AANP exam. Now, any other videos that you may see where I am teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. All right, question number one states a patient presents to the office with complaints of vaginal discharge that is a yellowish color. Upon examination, the nurse practitioner notes that the patient's cervix has a strawberry appearance. Based on the presentation, what is the best differential diagnosis? Is it A, chlamydia, B, gonorrhea, C, trichomonas, or D, bacterial vaginosis? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first because it allows you to slow down to ensure you're answering what is actually being asked of you with the question, right? So here the stem of the question states, based on the presentation, what is the best differential diagnosis? So again, we're looking for differentials. It hasn't been confirmed, but based off of this presentation, what is the differential should be at the top of your list, right? And I always tell you if it's asking about a diagnosis, you need to run it back and look at those assessment findings. So this patient came into the office, they're complaining of vaginal discharge, states it's yellowish in color. And then on exam, the nurse practitioner notes that this patient has a strawberry cervix. It appears strawberry in fashion, right? So again, this is one of those scenarios when I say this, you say that. So when I say yellowish discharge and strawberry cervix, you should say trichomonas, okay? Now, of course, we want to assess and go through and work through things um, when people present a certain way because it can be a variety of things. That's where our differentials come into place. But at the top of our list, when something meets those standard key identifiers, make sure you know it. And especially for testing purposes, those key identifiers know it. They're not trying to waver or trick you. They want to make sure that you know on an entry level the most common diagnoses and how they present and what you do and how you treat them, right? So, yellowish discharge, strawberry cervix, trichomonas, okay? So the best answer here is C, trichomonas. Question number two. The nurse practitioner has trichomonas as a differential diagnosis. What is the gold standard diagnostic test that should be completed? Is it A, transvaginal ultrasound, B, NAAT or NAT, C, wet mount, or D, nothing at this time? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question states, what is the gold standard diagnostic test that should be completed? B is your best answer. The NAAT acronym is a nucleic acid test that is utilized for many STDs/STIs, but it is a gold standard to quickly and easily confirm a diagnosis of trichomonas. Now, we can do a wet mount as well to look under the microscope, but that's not the gold standard. Pay attention to the terms they're asking you for this. Like if you see things that say first line therapy, initial, gold standard, things of that nature, make sure you're not getting tripped up by stuff like that, okay? But NAAT, answer choice B, is the gold standard, okay? All right, and question number three, the NAAT, we say NAT is positive for trichomonas. What is the best treatment? Is it A, amoxicillin, B, flagyl, C, doxycycline, or D, clindamycin? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question here, what is the best treatment? All right, so what are we treating? How do we treat trichomonas? So best answer here is B, flagell. We treat trick with flagell, okay? And I always say, when in doubt, that's one of those top things because bacterial vaginosis and trick, flagell are those first line therapy in those group of STIs, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure to meet me back here. Also, you guys, I did a video on how to find all of my system specific videos. I know I do daily practice questions, but I have over 300 videos, and I have videos where I am teaching on specific topics so you can get a better understanding. I have study videos where I'm working through it with you. I have videos where they're short and sweet just to cover a topic, and then we do the question, then we apply soap notes to it, and I have them all grouped in categories on the playlist. So I did a video to show you how to get to that because some of you have reached out and asked about it. So if you're just looking for videos to review, you guys, you don't have to scroll through all 300 videos. Like I said, I categorize them. So if you go to the top of your page, you'll see where it says playlist. Click on playlist and then you'll see it all grouped together. If you struggle, go look at the video where I'm talking through it to show you exactly how to get to it. So it'll be a little bit easier for you guys. All right. And if you need any of the resources I offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to that number or shoot us an email at the nursing studio, the number one at gmail.com. The things that I offer are my review book. My review book, you can get it in an ebook or paperback option. Both are linked in the bio of this channel. I do have a video where you can kind of see what you get with the review book, but it is designed for family as well as adult gero. It is broken down by system. And so each category, you have a chapter on a system. It's short and sweet, broken down how I teach y'all to study, assessment, diagnosis, evaluation, and treatment. Then with that, there's an interactive section to test your knowledge on those things. Then there's a mini medication list to kind of on those key medicines for that particular system. Because as I always tell y'all, don't make farm additional system to review. Study it with the system. So if you have a medication that you're treating with, study it for the treatment. Learn it if you struggle with it. Learn the drug class that it falls into, etc. Okay. And then I have practice questions at the end with rationales as well. So if that's something you're looking for, again, they're both linked in the bio of this channel, either the ebook or the paperback option. If you purchase the ebook, of course, you immediately have access on any device. Next is the independent review. If you're someone who likes to just listen to videos, teaching on topics and testing your knowledge on the go independently, I have a course, self-paced review course designed for family and adult gero for both exams as well. Also linked in the bio of this channel. Our upcoming 5-week intensive review starts in September, so you will see the link in a few. I will add that as well so that you can enroll in that if you're looking to join us in September. I'll put it in the description of this video as well. And then lastly, one-on-one sessions. With my one-on-one sessions, I always say reach out if you're looking to book a one-on-one session, just because I customize our one-on-one sessions based on what you need, what test you're taking. If you tested before, to see, engage what you truly need. But the options for one-on-one sessions are you can book a session for weaknesses. So say you struggle with a particular area, you can book a session 1 to 2 weaknesses per session. You can book an exam readiness assessment. Or you can book the custom package where you're provided a pretest to gauge where you are. And based off of the time that you're saying that you want to allot to studying, I structure a study plan for you for that duration of time and work alongside with you throughout that period of time to take you to a successful exam attempt. Okay. But that's everything. And if you need any of those resources, feel free to reach out to the Nursing Studio. But as always, happy studying. Make sure you meet me back here. Bye, y'all.